Hello, my name is Dr. Hillel Mazansky, President and CEO of Guided Imagery and Nutrition Incorporated. My website is www.gianinc.com and on facebook.com/guided imagery, all the health tips are stored. Today we're going to speak of something that is extremely common, and that is called gluten sensitivity. When one is sensitive to gluten, the disease is called celiac disease. Celiac disease is fairly common, and it is marked by people suffering with abdominal discomfort, abdominal distress, bloating, abdominal pain, and diarrhea, and in severe cases may even lead to weight loss and being extremely tired and dysfunctional. Gluten is the cause of celiac disease. What is gluten? Well, gluten is a protein that is found not in fish, meat, and eggs, but in all wheat products, such as barley and plain wheat, and all the products made thereof. So breads, brown bread, white bread, rye bread, cookies, croissants, muffins. All these items contain gluten. Cereals that are wheat cereals contain gluten. Rice cereal, however, is fine. Rice, cookies, rice patties can be eaten, as can be corn. Corn chips or corn cereal, that is fine. The problem is that gluten is sometimes hidden in prepared foods, and one has to be extremely vigilant if one suffers celiac disease not to eat the gluten. Today, the disease has become so pervasive that a lot of the prepared foods or other foods, it states gluten-free. So that helps a person who's doing the shopping not to ingest the gluten. For argument's sake, malt has got gluten in it, and one cannot drink malt beer. However, drinking wine or alcohol spirits are fine. No breads, brown bread, white bread, rye bread, any form of bread, a bagel is a no-no. However, if some substances are made gluten-free, then they can be eaten. But fish, eggs, meat, soy, other forms of protein, all fresh fruits and vegetables do not contain gluten. You can, however, if you want to have rice crisps or rice chips, corn or corn chips, that is fine. The problem with eating gluten-free diet is when one goes to the restaurant. So you have to be extremely vigilant and ask the waiter if there's any gluten in the food, because sometimes it comes mixed in a sauce, and you're unaware of that until you eat it and you get home, and then you get violently ill. So a gluten-free diet is not all that difficult to keep to once you are aware what has and has not gluten. My suggestion is to use any of your search engines, Yahoo or Google, and put in there gluten-containing foods or products with gluten, and then do the converse, gluten-free foods. And you'll be fully aware. I don't think it's necessary to go to a dietitian. You have enough intelligence to know what contains gluten and what does not. And we're seeing more and more cases of gluten sensitivity, and sometimes the symptoms can be nondescript, such as a little bit of abdominal distress, a bit of nausea, feeling tired. And once one thinks of gluten sensitivity and places the patients on a gluten-free diet, they improve dramatically. There was some research years ago that showed that possibly kids with autism respond to a gluten-free diet, but I think that's gone out of vogue because subsequent studies failed to prove it. But there's no harm on trying the child for a few months on a gluten-free diet if they have autism to see, is there an improvement or not. If there's no improvement, let them go back to eating a regular diet. If in fact they do improve with a gluten-free diet, then one continues. So gluten sensitivity is on the uprise, upswing. More and more people are on gluten-free diets because celiac disease is a disease that one doesn't usually think of until you see the patient and think, this might be celiac disease, and you try them on an exclusion diet of gluten-free products and they improve. My name is Dr. Hillel Mazansky, and I thank you for listening.